Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be exploring a condition that has emerged from the COVID-19 pandemic and continues to challenge patients and healthcare providers worldwide. It's called long COVID, also known as post-COVID-19 condition. It's a complex illness that can affect people of all ages, even those who had mild cases of the original infection. To help us discuss the science, the symptoms, and hope for better treatments, I'm joined today by Dr. Bryn Henderson, a board-certified physician and pioneer in regenerative medicine. Dr. Henderson, thank you for being here.
Well, you're sure welcome.
Let's start with what is long COVID?
Well, the World Health Organization defines it as a condition occurring in people with a history of confirmed or probable COVID-19, usually within 3 months from the onset of infection, with the symptoms lasting at least 2 months and not explained by any other diagnosis. What's tricky is that it can affect multiple organs and the symptoms often fluctuate over time.
All right, so for our listeners, what kind of symptoms are we talking about?
Wow, there's over 200 reported symptoms, but the most common are fatigue, shortness of breath, brain fog, palpitations of your heart, muscle and joint pain, insomnia, loss of smell or taste, and the digestive issues, as well as, of course, anxiety and depression from having it. Many patients also experience what is called post-exertional malaise, meaning symptoms get worse after physical or mental activity.
Why do some people develop long COVID and others don't?
Great question. Genetics play a big role. Studies have linked certain genes to have a higher risk. These influence immune responses, inflammation, and even how the virus enters cells. Beyond that, the risk is higher in women, middle-aged adults, and people with conditions like diabetes and those who were hospitalized for COVID.
Does our early development have anything to do with it?
It might. The way the lungs, brain, and blood vessels develop during early formation in the womb can alter certain cells, which may explain why some people have more severe or long-lasting effects.
How do you diagnose it in your office?
Well, that's a little tricky. There's no single test. We rely on their history, the symptoms, duration, and ruling out other causes. Imaging and lab work can help assess the specific problems like blood changes or inflammation. The challenge is that symptoms can be subtle or overlap with other conditions.
Well, let's talk about those treatments now. What's standard of care for long COVID?
There's no universal cure, but management is multidisciplinary, meaning we tailor treatment to the patient's symptoms. That could include pulmonary rehab for breathing, cognitive therapy for brain fog, medications for sleep or pain, and mental health support. On the regenerative side, regenerative cells and exosomes are being studied for their ability to calm inflammation, repair the damaged cells, and support nerve function. We also have peptide treatments designed to block the virus from binding to cells. In some outpatient cases, high doses IV vitamin C has also been shown to have promise for improving fatigue and cognition.
Well, I like hearing that. So I want to go back and talk about these peptide treatments that block the virus. I know a lot of people would want to know that even if they don't have long COVID, but they are, you might be at work and you hear the person sitting next to you is out of work because they test positive for COVID.
What you see here is that those peptide treatments are designed to block viral cell entry, typically working by mimicking a viral protein or receptor. Thereby, it prevents the virus from getting in. It prevents the virus from binding to the host cell. These peptides can be either directly bound to the virus or to the host cell receptor, effectively acting as a decoy.
Okay, let's move on to traditional Chinese medicine.
Okay, that's good. Traditional Chinese medicine can be very helpful, especially if there are lingering symptoms like fatigue and respiratory symptoms, as well as emotional distress. The herbal formulas target inflammation and boost immune balance. Acupuncture is also showing strong results in improving fatigue, mood, brain fog, and even smell and taste.
Okay, what can a patient do at home?
Key steps include pacing activity, getting enough sleep, staying hydrated, and eating nutrient-rich foods. Working with healthcare teams for gradual rehabilitation and psychological support is essential. Long COVID can be isolating, so counseling or peer support groups can make a real difference.
Okay, so you mentioned vitamin C. What amount of vitamin C can a patient take, or a person who wants to prevent long COVID, without going overboard?
It's like most medications. Vitamin C is an antioxidant. It helps the cells in our body. So what we strive to do is balance it compared to what else is already there and going on in your body. So those doses are tailored to the patient. And some of them are oral, but most of them are actually accentuated if you take them IV.
All right. So now that we know about that, what's the prognosis? Because these people that come in with long COVID have a fear on their face when they look and say, "Doctor, you've got to help me." And no one's understanding what I'm going through.
That's very true. It's a bad spot to be in if you're the patients, because although patients improve over months, especially with the right support, about 15% of them have lingering symptoms for almost a year. Recovery is rarely linear. There are often ups and downs, so follow-up care is crucial.
All right, let's do our mnemonic for long COVID.
The mnemonic is recover.
R
Is for rehab programs, pulmonary, physical cognition, and occupational therapy tailored to symptoms.
E
Is energy pacing. Avoid overexertion. Manage activity levels carefully.
C
Counseling, mental health support, or mindfulness therapy.
O
Oxygen and cardio support for patients with desaturation or POTS, postural orthostatic tachycardia syndrome.
V
Is for vitamins and nutrition, adequate protein, antioxidants, and micronutrients.
E
Emerging therapies, regenerative cells, exosomes, peptides,
R.
regular follow-up, continuous monitoring, and care adjustments.
Well, thank you, Dr. Henderson, for shedding light on this evolving condition. Long COVID is complex, but with a combination of medical care, rehabilitation, and lifestyle adjustments, many patients can see meaningful improvement. If you or someone you know is struggling after COVID-19, know that help is available. Seek care, track your symptoms, and be patient with your recovery. Thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.